Welcome to Horton Implants Oral Bites with your hosts, Kate Bootman, Will Murphy, and Carl Horton.
Hot under the collar.
Yeah, I know the feeling.
Oh, goodness.
Is this your latest bit of merch?
No, it's trolley tokens,
we've
mate.
had those for a while. Well, everybody, what
Everywhere.
a welcome back. I hope you're all okay. And you've probably heard that we have a member of the panel that's going to sweat all over his keyboard. I say nothing else. Welcome back, everybody. Hope you're all okay. You can see we got the lovely Will Murphy and the lovely Carl Horton. Good evening, gentlemen. How are you?
Yeah, good, thanks.
Very good.
Yeah.
You're all right?
Yourself?
Fantastic. Well, Carl, thank you for asking. I'm not too bad. Thank you very much.
Good.
Right, boys. This week, apart from being really, really hot, and if you say you've had air conditioning, there's going to be a lot of jealous people out there. So come on, Will Murphy, tell us about your week.
My week, yes, I do have air conditioning everywhere I work, everybody. Sorry about that. Except, although Wednesday morning...
Is that like a demand?
Yeah. Oh, I won't get out of bed unless there's air conditioning. Everybody knows that. I go proper full-on diva. So that's demand number one, along with the blue Smarties in the staff room as well, you know.
Oh,
very,
my
very
goodness.
specific. Mind you, saying that on Wednesday morning, the aircon hadn't really kicked in. So I'm going to implant first thing, where, of course, we're all getting gowned up.
Sorry.
I looked at the clock. I think it was about 20 minutes by the time we were all finished and the patient was out the door. It was all fairly swift, all perfectly done, may I say.
Of course.
But yeah, if ever you feel like you need to get a wriggle on, just have no air conditioning. Bye, Carl. That's it. Oh, you just disappeared.
I know. I was just politely asking my son to keep it quiet.
Very good. Will, can I ask a question?
You can.
So they're your two demands. So that's air conditioning and blue Smarties, probably in that order.
Yeah.
Is your third one a drink in your Will Murphy cups?
I'm okay for non-branded cups as long as there is coffee on a table for when I arrive. So they've got to get the timing right, just so it doesn't cool down too much, and everything's okay. We'll all have a perfectly smooth day if my demands are met. So there you go. That's the aircon bit. But of course, it's Freedom Week. It's all over now. War is over. COVID's gone away. So
unless you've got a phone with an app on it.
Oh yeah, then you've got to stay at home for about 2 years.
Yeah.
But apart from that, you can go into a pub and lick people's eyeballs, and if you want to, and everything will be all right. So there you go. And also your notes. I've got my.
Yeah.
We saw. Very
There we go. Saturday, first test. So there you go. And I've got the day off tomorrow. God,
nice.
Who would have thought?
Just too cheeky. This is too cheeky. Eject him.
So apart from that, it's all right, really.
Fantastic. Well, I'm glad to hear that. What about you, Carl Horton? How has your week been?
Yeah, just hot, like everybody else.
Not me. No, I was very cool. Surgery. Oh, sorry. Carry on.
Yeah. Do you know, it kind of doesn't really. I kind of seem to temperature adjust quite well in the heat. It doesn't really seem to bother me too much. It bothers the family and the dog. I've got aircon in a couple of the practices, and the ones that we didn't have it in. I think the nurse fainted, but we'd sutured up. So it was all right.
Did you step over her?
And then Sunday was my family have got links to Formula One from way back. My uncle was an engineer for Ford Cosworth, so he did a lot of work. He was chief engineer actually, quite a big interest in it, kind of growing up and all that sort of stuff. And watching Silverstone and Hamilton and Verstappen bash it out. I got quite vocal, you know, in a good way, or a bad way, whoever you support.
Are you into it? Do you like watch all of them?
No, I don't watch all of them. I'm into it by proxy in a way, because that was what kind of my uncle kind of sort of used to bring back, and then we'd be watching kind of to support him and his team. So years back in the 80s, 81, we got tickets to go to Silverstone. It was very different in those days because we were actually in the pits. So I was really fortunate. Wow. Actually got to sit in the Formula One car that was being taken out onto the track. That's how different it was then. And the actual person that was driving for ATS was a chap called Slim Begurd, who used to session drum for ABBA. So, yeah, so it's absolutely amazing. I mean, probably a fan, you know, one of the top 10 days of my childhood life. That was absolutely incredible day.
Stop name dropping. Will and I'll
it's the only time I care. It's the only thing that's ever happened.
Yeah, come on, tell us about Monaco as well. Go on.
Yeah,
if you must.
That's why I wear these.
Can you get me a ticket to go as well? That'd be
that's why you've got your chair. It looks like a racing driving chair.
Oh yeah,
that's what I've decided.
Yeah, or a football manager, I think, isn't it? It's, you know, in the dugout these days. They all have these posh chairs, don't they? Except you've probably got Horton implants on the back of yours.
Yeah, there probably is. Yeah, it wouldn't surprise me. So yeah, I watched that with a bit of interest, but no, I'm not a massive fan, but I am kind of like, you know, if it's on, I'll enjoy it, but I don't mind if I don't watch it at all. You know, I'm not that much of an avid fan. I know I've got friends that are absolute fanatics about it, but no, I'm not quite that much of a fan. He's off again. Do apologise.
I blame the parents. Just no discipline.
Oh, absolutely.
Yeah, there isn't any. It's just, I'm too tired to discipline. It's too hot. Stop, Shane, please. And then, yeah, I mean, interesting days. Again, steady. You know, I had one issue with a denture on 4 implants, which was a little bit interesting. It's been scanned, and it has a slight rock on it, which is sort of, you know, the patient doesn't like, and I can understand that. And it's how to resolve that. And I think we've just got to go back to basics with it. And sometimes you get these things with the dentures, that they are dentures and they're not fixed.
Is it locators?
Yeah, they're on locators. Yeah. You and your sleeves.
However, well, I was going to ask a question about that, just to bring it through neatly around. How do you do your final pickup, or how do you actually get the inserts in? Do you actually do a pickup in the mouth, or do you let the technician do it off a model?
Do you know, I've done it both ways, and the way that I was taught, and probably the way that I prefer, is to do it in the mouth. I've done it with the technicians, and I'm always a little bit, I don't know what it is, I'm always a little bit worried that there's going to be a change in the impression between taking the impression, the technician casting it up, and the accuracy of what they receive. For is silicone, I use silicone with a wash, and what they receive on that, I don't know. It's just, I just feel that doing it chairside.
I agree.
Okay, that's good.
Yeah, not that anyone cares if I agree, but I'm just saying, you know, because I think, once you've cut out one of the little inserts in surgery and got yourself covered in acrylic powder, and then spent another sort of whatever half an hour waiting for your acrylic to set, you sometimes just think, oh, maybe if I just pick it up in the first place.
Yeah.
And I think the other thing about sometimes those little plastic inserts, they're just slightly off. They just start getting distorted, don't they?
Yeah.
And then they come in a few weeks later, and it's this one is loose and this one's tight and all that kind of thing. But there's obviously can be a hazard with doing it in the mouth, can't there, in terms of turning it from a denture into a fixed bridge.
Yeah, that's happened to me.
Yeah, it's happened to me too. I'm glad to hear that.
Such good fun, isn't it?
It's great fun. Yeah.
Trying to find the housing.
Yeah. Happy days. Thank God it's not just me.
Oh no, mate. And it's just that stomach goes like that, and then it's still, you get there, you've been drilling away, and you're thinking, I really don't want to hit soft tissue.
No.
I really think I'm aiming for that housing. It looks like I'm aiming for the housing.
It's somewhere nearby.
It's when it starts spurting with blood. That doesn't happen, by the way. It's not.
Oh.
These are implant jokes, everybody.
Yeah. And the other thing that I mean, I must admit, managing patients' expectations with the dentures is probably harder, I find, than any other restoration. That aesthetic expectations can manage that. I can manage bridge expectations, phonetics, all of that I find manageable. But the denture expectations,
say, Carl, just quickly, because if there are people out there that are non-dental, so.
Really?
For us, it's common sense. Yes, there is. And, there is. So obviously dentures, when Carl and Will are talking about dentures, obviously they're removable. So they are the ones that people go plink plonk. So when they're talking about the bridges on implants, that is fixed. You can't take it out. These wonderful people can. So that's the big difference. But carry on.
Well, usually you can take them out unless they get stuck. But you can't leave them there because you can't clean underneath them. So you have to be able to take them out because they're not designed to be left in.
I try not to do them on 2 locators anymore. If I can, because again, for anyone non-dental, it's kind of, they'll still do this, and so people can still find their rubbing, and quite a lot of them still do. So if ever I can, I'm really trying to do them on 4 implants, but like you said, there's still a lot of expectation to be managed.
Carl, you were going to say please say, because I think I know what you're going to say about the expectations with the patients and the bridge and the dentures.
Well, it's still a denture at the end of the day, which means that it can still rock. It can still get little bits of food underneath it. It's still a little bit, not always, but it's still sometimes a bit bulkier than the bridge. So it's still something that's removable. It's not fixed teeth, and I think that's the big difference, is that it gives more attention to the denture, but sometimes that's not what people actually want. They seem to want the fixed teeth, and it's not fixed teeth, but it's sometimes the better solution than fixed teeth for some people. I mean, there's some people that bless them, they've come in and they've said, "Oh, it's a little bit loose," and you know who you are, and then they kind of. They really have to pull the denture out, and I think the word loose is the wrong thing. I think it's because it moves slightly rather than stays fixed. I've had one, bless her, lovely lady, and her son had designed some radiator clips. So she'd actually had these radiator clips melted because she got poor dexterity, which she used to clip underneath the upper denture to pull the denture out. And I remember she turned up and asked if I could sort of help her with this implant retained denture that she was struggling because it was a little bit too hard to take in and out. So we did what I thought was the correct thing. I changed the inserts for a slightly less retentive insert, and she came back and said it was horrible because it was too easy to take out. So it's getting that fine balance sometimes, and that can be really, really difficult. I find anyway. For me, it is.
Yeah,
very much so.
So to all you CDTs out there,
respect.
100%. And you know what? I think it's in how things get explained as well. So in some patients' head, they know what they want and it's very clear, but what comes out of their mouth is different. And the way we sort of take that on board is different too. So sometimes it can be a bit of a struggle, can't it?
Yeah. Well, my dad, God rest his soul, was a consultant prosthodontist in Cardiff University.
Wow.
And so he used to deal with dentures literally all the time. So and he got into implants, I think, in the 70s and 80s, but by and large he used to be just doing dentures sitting on mucosa, and he was a bit of an old wag. And so when patients would come in and say, oh doctor, my denture's moving, he used to take it out, put it on the table and say, no it isn't.
Oh, I love it. I love it.
Stand there with people looking confused, like, and
That's excellent.
And lots of students looking a bit embarrassed.
That is excellent.
Not sure what to say or do.
That's the best way to be. I think that's amazing.
Absolutely brilliant. But yeah, I love working with CDTs. I absolutely clinical denture technicians, because I remember there's some people that so these guys have got taken an additional qualification. So a lot of them have started potentially as lab technicians, just making the dentures. So the dentist will send the impressions, they make the denture within the lab, and then they return it and the dentist fits it. But what they've got is they've got this additional qualification where when it comes to actually making complete dentures where you've got no teeth, they can make that for patients without the patient having to see a denture. So that's quite suitable for quite a lot of patients, because some of them are apprehensive about seeing dentists, so they don't need that dental intervention. And then patients that have got teeth, then they can do the whole denture from start to finish, as long as they have a prescription from the dentist where the dentist has diagnosed anything that may be wrong with the actual teeth themselves. So they are a really good, adjunct to working with and helping patients out. I think that.
And dare I say it, may well make dentures better than dentists.
Oh yeah, absolutely.
Well, me anyway.
Yeah, me. Yeah, 100%. 100%. I really like. I'll much prefer to work with a CDT than make the denture myself. If I'm honest,
it's an absolute art form. Dare I say it?
Yeah.
It really is, isn't it? There's a lot of skill involved.
Yeah,
so much skill.
Yeah, how anyone can get a lower denture to, actually sit still. With all the things that are going on around it, I mean,
and patient management as well. Just sort of managing, because I think that, like I've said, that the more patients with the expectations are those patients that come in with the implant on dentures. And those are the patients that they're looking after. And I think they just seem to be able to manage those expectations just so well.
And I think also for, again, I'm not sure how many full sets of dentures, the newly qualified or the students may be doing these days.
It's all done online, Will.
Is it all done online?
Sorry, students.
Yeah, seems that way. Yeah. But and that's not me bemoaning the youth of today, which I like to do on every possible occasion. But I think that level of experience, not that it made me particularly good at making full dentures, but certainly I had plenty of experience in giving people denture glue and doing denture eases and that kind of thing.
Yeah, absolutely. I remember I met up actually with Giles Perrier, who was my original mentor. I worked with him. Emma used to work there as well at the practice, and I was blessed with him and Emma looking after me when I started. It was just fantastic practice to work in, and he referred this patient to me that he really struggled with an upper denture, and it was really hard work to help this person out, because to manage her expectations was really difficult, until she just said a little key word, and the key word was I only want it. I can't remember exactly what it was, but it was just something she dropped in that meant actually all she wanted was 5 to 5 on this tiny little plate, not your normal sort of number 6 and maybe a little bit of plastic where the number 7 was. She didn't care about retention. She didn't care about chewing with it. She just wanted this 5 to 5 smile to pop in, so that if she ever went out or anybody came round, she could get this denture just clicked in and talk to people, and that was it. She didn't want it for any other reason. So all the dentures that have been made clinically to fit her mouth, with retention, stability, all those factors, the occlusion, everything sorted out. She hated them because they were too big. And then when you ground them back, because they weren't made from 5 to 5 specifically, they started to drop, or she could feel the ridge. And it was one, I can't quite remember the words, but he came in, he went, "How did you fix that? How did you?" I said, "Do you know what?" I said, we just went down the wrong road with her from the start. And this is all she wanted, this stubby little kind of baby denture that she wanted to pop in for when her friends came around, that she could just go, "Oh yeah." Yeah.
Well, as I say, communication. The patients what they want up here.
Yeah.
And I think good, but we can be just too busy.
Well, you just go into clinical mode. You just go into, I'm making you the optimal denture. What's the matter with you? You know, this is fully extended. It's retentive. It looks great. The occlusion's perfect. What do you mean you don't like it?
Yeah, there is the problem where sometimes we think dentist knows best, and you know, you're going to have what we decide you're going to have, and you're quite right. I think you know, just taking the time to find out who the patient is, what they want it for, what their expectations are. I mean, this makes a massive difference.
It does, doesn't it? It does.
Huge. And I mean, I think this could go across other professions as well. But I think, you know, for all the qualifications that you guys took, which are fantastic and wonderful, having that core value.
Mine, to be fair, Kate.
That doesn't surprise me. But having that
Photoshop.
Having that value of being able to listen, I think, pays off dividends, doesn't it? Really.
For Carl.
Oh yes. Come on, Will. It was only a couple of weeks ago you and I had to be in listening mode. Let's not go there. Let's not go there.
Somebody sent me a ADHD test. I can't remember who it was. So I got this test saying, "Do you suffer from ADHD?" And so I took it just to you know, and I've definitely. And some of the questions were, "Do you struggle to keep your attention span when someone's talking to you for more than 2 or 3 minutes?" And I thought, yeah.
Was this from your wife?
She says no.
Okay.
But I think maybe, I don't know. What's the opposite of ADHD?
I don't know. Well, it's also fairly close to boy listening, as I get told. You know,
yeah.
Which is a bit like boy searching for things, you know, that you can't find. Where apparently you have to lift things up to look for things and that kind of stuff, you know.
Isn't that what we say to kids, isn't it? As a parent, like, go and look with your eyes open. Come on, don't tell me you haven't used that phrase. Now go back and have a look with your eyes open.
Well, it could be genetic, because I've got a perfect example. We were on holiday with some friends once, and where we were, you had free ice creams and lollipops, and they had these little refrigerators that the kids could go in and get a lollipop, and it was unlimited. But we obviously limited Seb, so he couldn't have them all day long. So there was a certain limit as to how many he could have, and it disappeared off, and Kelly got quite worried and concerned. And he was in the pool, and you just couldn't see him. And you know, I'd clocked him, but I hadn't realised that she was worried. There he goes. And
he's got hold of my blue Smarties, hasn't he?
Yeah. So when he came back, I could see him and Kelly kind of, you know, she's going, "Don't do that again," as you do when you get a bit stressed. You know, "Where were you? I was really worried." And I'm kind of sauntering over, and he's got this kind of being told off and this worried concern from them, and he's just like this, like that, and she finishes, and he just goes, "Can I have a lollipop?" Absolutely nothing has gone in whatsoever. He's just got one thing on his head, in his mind,
waiting for the sermon to end.
Yeah, just waiting.
He teed up his question.
Yeah,
he was all ready to go.
Mouth was moving, but definitely nothing was coming out, because he's thinking lolly.
Waiting for the cue. Yeah, absolutely.
There wasn't even. I don't think there was about 5 seconds between Kelly stopping and asking the question. Can I have a lollipop?
Love it. I love it. Well, I think that's a fantastic time to stop talking about lollipops.
I'm going to go.
Yeah, I'm going for a curry.
Oh, nice. Where are you going to go? Where are you going to go?
Tiffin on the high street.
I've heard it's very nice.
Yeah, with my daughter and her boyfriend and Sarah. So yum.
Oh, I should think so.
What are you going to have? What are you going to have?
The Modu Minty Lamb.
Yeah, nice. Do you have a starter?
Nice.
Yeah, be a tandoori king prawn.
Oh, yes.
Probably a nice cold cobra or something like
that.
No work tomorrow, everybody.
Yeah.
Drinking and dentistry is bad.
Yeah.
Also,
we don't condone the eating of sweets and lollipops all day, if we can just say.
Sugar-free, obviously, if you're going to do that sort of stuff.
Absolutely. Well, gentlemen, it's been an absolute pleasure. And
Brilliant.
For those of you out there, it's going to be a little bit of a cheeky week off for us three next week. So we look forward to seeing you the week after. Gentlemen, as always, thank you very, very much. Enjoy your curry.
Thank you.
Have a lovely weekend, everybody.
Yeah. Cheers all.
Bye.
Thanks a lot. Bye.
Bye.